This is TTT Live. I'm DK Ronstar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Choke City 91.1 FM, and on Facebook at TTT Live Online. We now go to Al Alexander, Senior Corporate Communications Officer at the Ministry of Health.
Good morning to our listeners and viewers on the various media platforms. Welcome to the Ministry of Health's virtual media conference for Wednesday, 19th May 2021, where we provide you with current and accurate information on the Ministry's COVID-19 response. Today in studio, we have the Honorable Terence Yalsing, Minister of Health, Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions, Dr. Avery Hines, Technical Director, Epidemiology, and Mr. Davlin Thomas, CEO, North Central Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for this morning's media conference. We begin with Dr. Avery Hines, who will provide the clinical and epidemiological update. Dr. Hines.
Thank you, Mr. Alexander. Good morning to the Honourable Minister, to Dr. Richards, and to CEO Davlin Thomas. Good morning to the members of the media and the viewing and listening public. This morning, the clinical update is as follows. If we can have the first slide up, please. Well, actually, the second, that one, yes, correct. As at the 18th of May at 4 p.m., we would have tested at public and private facilities over 159, nearly 160,000 samples, of which 17,150 would have come back positive to date. And of those 17,150, we would have recorded 601 yesterday, which represents a time frame which I'll explain in a moment after we finish the actual update. There are currently 6,318 total positive cases, and of those, 387 are currently in hospital. We have 10,515 recovered patients, and we would have recorded up to yesterday 317 deaths, and we extend our condolences to the members of those bereaved families. There are 129 persons in step-down, there are 336 in state and quarantine facilities, and there are 5,201 individuals in home self-isolation. Next slide, please. As we move to the next slide, we see what we've seen before, that epidemic curve, which shows the number of cases as they occur, as the swabs are taken on a day-to-day basis. And here's where I just want to explain, or just to emphasize, that for the update yesterday, where we had 601 positives, that represented actually two batches of results. One that would have been from the 48 hours preceding, as usual, and one that had to clear a little bit of a backlog within the network before the results could actually be tallied and included. And that was from a time frame that stretched back to the 11th. So that having been sorted, we hope that we'll have a narrower range as we move forward, corresponding to the normal range of 48 hours or so before the update. Now, we do see that the numbers are continuing to increase, and that rolling average, that dotted line, is continuing to trend upwards, which is our concern. Moving to the next slide, what we see is that the week-to-week graph and the positivity, that salmon bit in the background, really shows that we're at about 40+% positive cases out of every 100 cases or every 100 samples that we actually test for coronavirus. Next slide, please. Looking at the totals by month, we see that so far for the month of May, we've exceeded 6,000 cases, and the overall positivity for the month of May was about 40%. Next slide, please. And the distribution of the positives remains largely as it has been, majority in the 25 to 49-year-old age group, and we're seeing more of a swing towards an equal proportion of males to females. Right now, 51.9% are males. Next slide, please. In the deaths, we're also seeing a bit of a swing from the previous sort of proportions, where we were seeing 3/4 of the deaths being among men. We're now seeing that coming down to nearly 63% being male and 37% being female. and that the deaths in that under 60 age group do represent a slightly higher proportion than we would have seen up to March this year. Next slide, please. Looking at the projections as they had been judging or using the rates that were occurring at the last 2 weeks of April, we are finally beginning to see very minimal decreases in terms of the new cases not quite reaching that green projected line. Now, this is really just the beginning of what we hope the population's adherence to the public health measures will continue. We're hoping that with the adherence, now that we're about 3 weeks out from the biggest measures that started on April 29th and were augmented since that, we're hoping that this mild slowing that we're beginning to see here can be maintained by the behaviors of the population as we adhere to the measures, adhere to the minimal movement, adhere to the mask wearing, adhere to the physical distancing, adhere to the avoiding work when we are ill. Also adhere to the remaining in house when in quarantine, because we are getting reports of people leaving quarantine to go to the grocery, etc. That's not what we need at this point in time. We really need full adherence to continue this breaking force. Next slide, please. And last but not least, for me, as you're seeing the current and projected new and active cases, the green line that moves from left to right and it moves and it's trending upwards, we're now seeing again where that is now starting to deviate slightly and become a little lower than the yellow dots, which were the original projection. Again, very minor slowing at this point. We need a lot more of the adherence to keep that slowing going in the right direction. And the projected green bars saying how many new cases we're expecting at this point, we do see that the new cases that are actually the orange bars behind the green ones, those orange bars are a little shorter. So we're hoping that this is the beginning of the trend that we're hoping to see towards a breaking force. But this is where the population really needs to band together, hold the fort, hold the line, and continue to adhere to the measures in order to get this to continue in the desired direction. Now that brings me to the end of my clinical and epidemiological update. I turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. We will now have an update on the parallel healthcare system by Dr. Miriam Richards.
Thank you very much, Mr. Alexander. Good morning to the Honorable Minister, to my colleagues, Dr. Avery Hines and Mr. Davlin Thomas of the NCRHA. Good morning to the members of the media. Thank you very much for your continued attendance at these press conferences. And good morning to the viewing and listening population of Trinidad and Tobago. This morning, I would like to provide a brief update on the statistics in the parallel healthcare system with an emphasis on the hospital occupancy and step-down occupancy at our facilities in the parallel healthcare system. This information was collected at 8 to 9 a.m. this morning and is up to date, and it's collected by the Office of the Chief Medical Officer and reviewed. So, the rolling average has increased to 478. Increased hospitalizations are a result of increased rolling averages. Next. We continue to see an upward trend in the number of hospitalizations on a daily basis. There is a net increase in the number of patients being increased at all our hospitals, resulting in an increased occupancy. Next slide. You would notice that there is a gap between the admissions in the orange line, that is, admissions are greater than discharges, and this is reflective of the increasing caseload that we have noticed between and especially over the last 2 weeks. Next. Again, the hospital admissions continue to increase. That has been the trend. Decline is noted, but it's due to the lack of capacity at some of the hospitals or occupancy beds, of course, which is a changing sort of variable. Next. This is a slide of concern which demonstrates the occupancy levels at the hospitals in Trinidad and Tobago. As you can see, the 75% line, which is vertical and in red, indicates a warning sign that our hospitals are nearly being filled. Please remember that even though physical beds may be available at certain hospitals, the supporting resources, that is nurses, doctors, medication, ventilators, may not be available. And we've noted this challenge especially at the Covert Medical and Multi-Training Facility. Of course, we have measures to try to step up and to increase the levels, the resources that are applied, but however, these resources are limited and finite. If you look at the Trinidad occupancy, you would notice that it is even higher than the total occupancy, and we are this morning at 84%. Basically, in simple terms, our hospitals are filled. This means that soon patients who require care at our traditional hospitals will be compromised. Think of a case of your child having a severe asthmatic attack, and you are calling the ambulance service, and the ambulance service is basically transporting patients who are COVID positive. This results in you being unable to access the ambulance for your child who is having difficulty breathing, and of course may suffer or will suffer a negative consequence. Think about a similar scenario for a pregnant mother who is having a complication. And this is the sort of impact we are seeing. Tobago is increasing as well, currently overall at 29% this morning. Next slide. Again, increasing occupancy across all wards. ICU this morning, 77% overall, and increasing because we have patients being admitted, and HDU is 100% in Trinidad and Tobago, 95% overall. Next. This is just a summary slide of the hospital occupancies at the hospitals in the parallel healthcare system in Trinidad and Tobago. The Cora Hospital is at 89%, the Covert Medical and Multi-Training Facility at 75%, Augustus Long is at 94%, the Arima General Hospital is at 93%, St. Anne's is at 100%, and at our step-down facilities, the Point Fortin Area Hospital is at 75%, the UTT hospital, where we increased the bed capacity by 10 beds over the last 24 hours, is at 52%, and the Davis step-down facility is increasing at 86%. With this sort of trajectory, we anticipate that the traditional health care system is going to be compromised. We continue to try our best to allocate more staff. We are actually reallocating staff from quarantine sites and other sites in the parallel healthcare facility. We are converting beds as required from ICU and HDU, but these resources are limited. Let me give you an example of the resource limitations as it applies to the ambulance service. Next slide. Next slide, please. This is the COVID ambulance transports as a percentage of the total. And I'd like to reiterate to the population and to everyone that 50% on average of all ambulance transfers constitute COVID-19 patients. The turnaround time for this sort of transfer is extended as compared to a regular transfer. So, in summary, 50% of the ambulance resources, 50% of those vehicles that we see are consumed in COVID-19 transportations, leaving only 50% available on a daily basis for the traditional system. The RHAs have introduced contingency plans to address this challenge, but again, resources are limited. In summary, I would like to remind members of the population that we can stem and we can slow this process of hospital admissions. We can reduce the number of patients and our relatives, friends and neighbors who are dying on a daily basis. We need to be hopeful. We need to continue to practice the COVID-19 prevention measures, as Dr. Hines indicated. Please, let us all continue being a resilient, civic-minded, and responsible population. Let us continue being our brother's keepers, and we hope to stem this increasing trend and this upward trend in hospitalizations and deaths in the near future. Thank you very much for your attention, and I pass you back to Al.
Thank you very much, Dr. Richards. I now invite Mr. Davlin Thomas, CEO, North Central Regional Health Authority, to provide an update on the operations at the NCRHA. Mr. Thomas.
Good morning. Thanks, Al. Just some operational highlights. The NCRHA would have, based on the projections, invested in some COVID-19 testing equipment to facilitate the alleviation of bottlenecking at particularly the emergency departments. Today we would see an additional 2 PCR Abbott Nows, which would be included in the system. Those would be able to provide testing in 13 minutes. We also increased our capacity to do the gene expert testing, which runs on 1 hour cycle. So we have additional modules of about 3 modules, and we also bought an additional gene expert. So, and particularly to alleviate the bottlenecking at emergencies due to rapid testing. We've added additional beds to the UTT Valsane Hospital, field hospital. We basically would now have an additional 10 delivered again today, so we would increase capacity today. In addition to that, we've increased over the last 2 weeks based on the surge, additional barricading and segregation of the public from patients, and that is very apparent at the Eric Williams Medical Sciences Complex now. In addition to that, we've increased the capacity at the Chaguanas District Health Facility to facilitate an additional 300% in terms of the space, so that we could alleviate some of the movement from the Chaguanas area into the Eric Williams Medical Sciences Complex. So we have now an additional 300% capacity, which was done, as you may be aware, overnight. We've also increased the oxygen capacity within the system by 50%. So we have a surplus capacity in waiting as a contingency. In addition to that, we've also, as the Minister mentioned before, we also have an inherent oxygen generating plant, and that is in operation. And as well, we've invested in some high flow cannulas that will now provide, or at least mitigate against patients having to go on ventilators, and so that we've injected at least 20 more into the system. We've also injected additional trolleys for patient comfort and so on. We've also reassigned our inherent ambulances to support the GMRTT trust. The issue though is that we will have an additional 3 injected in the system again within the month. We've also employed handymen, patient escorts. We've also employed patient care assistants and CSRs to bolster our engagement. We've done major refurbishments to the Tacarigua Enhanced Facility, and we've handed over recently to the Eastern Regional Health Authority for operations. In terms of our engagements to facilitate the clinical staff and the rising demands on them, we have and in particular build resilience within the system. We have Professor Hutchinson, and who is a psychiatrist or the head of psychiatry for the region, and he is also engaging with a team of psychologists to do detoxing, etc. That is ongoing. And slide please, in terms of the recommencement of the NCRHA COVID-19 rollout. Next slide please. Just a reminder that the NCRHA would have administered 17,000 vaccines within the past, the previous drive in 2021. Next slide. Vaccination allocation. NCRHA will be administering 13,500 Sinopharm vaccines strictly by appointments only. We would be using our database to facilitate those appointments, the appointments that we would have generated previously. 13,500 Sinopharm vaccines will be distributed to the 8 primary healthcare facilities. Next slide, please. And these include Arima District Health Facility, La Joquita Health Center, Chaguanas District Health Facility, St. Joseph Enhanced Health Facility, St. Helena Health Center, and those are beginning on Friday, the 21st of May. Additionally, on Wednesday, the 26th of May, we will include the Cunupia Health Center, the Maloney Health Center, Aruca Health Center. Next slide, please. These are the numbers for WhatsApp appointments assigned to each facility, and they are as follows. Arima District Health Facility, that's 682-0277. La Joquita Health Center, 682-0217. Chaguanas District Health Facility, 682-0166. St. Joseph Enhanced Health Facility, 682-0187. Again, these are for WhatsApp appointments. Cunupia Health Center, 367-1741 or 367-4293. And Maloney Health Center, 367-2256 and 367-4377. Aruca Health Center WhatsApp appointments, 367-2354 and 367-5034. Next slide, please. And our COVID-19 call-in appointments, the numbers are again on the screen for your information. Thank you, Al.
And thank you, Mr. Thomas, CEO, North Central Regional Health Authority. I now hand you over to the Honorable Terence Dale Singh, Minister of Health.
Thank you very much, Al. Good morning to Dr. Richards, to Dr. Hines. Good morning to CEO Davlin Thomas. Ladies and gentlemen of the media, the listening and viewing public, wherever you are, a good Wednesday morning to you. Today is a good day for us in our vaccination drive. As Trinidad and Tobago may be now aware, our 100,000 doses of WHO approved EUL vaccines, emergency use licensed vaccines, did arrive in the country at around 1 a.m. this morning. So we now have bolstered our stock by 100,000. This is a direct result of a diplomatic effort that the Honorable Prime Minister, Dr. Keith Rowley, undertook on March the 16th, I believe, when he spoke to his counterpart in China. And we are grateful to the People's Republic of China for this wonderful gift at this particular time. It is my pleasant duty this morning to explain to the population how these vaccines will be rolled out starting on Friday. If I can have the first slide, please. Right. So WHO granted Sinopharm COVID vaccine EUL. We are going to continue now with phase 1 and also parts of phase 2 as we did last time. I did promise the country once the vaccines are here, we will start to administer shots in arms within 2 to 3 working days. The vaccines came in at 1 o'clock last night. They were sent to the Covert facility by around 3 a.m. this morning. And the team started to work at 6 a.m. to package and distribute vaccines to all the sites in time for Friday. And at this point in time, I really, again, want to thank healthcare workers. Some of us, I was in the airport with them. We didn't leave there until around 2 o'clock this morning, and they were back on the job at 6 o'clock this morning, working for us. Who will be eligible to receive these vaccines starting on Friday? People over 60 years, regardless of your health status. So if you are well, or whether you have diabetes or hypertension, once you are over 60. As we did last time, people under 60 with non-communicable diseases such as high blood pressure, diabetes, asthma. While obesity is not an NCD, it is a condition that predisposes you to a bad outcome with respiratory diseases. So come out and get vaccinated. Healthcare workers, our wonderful, beautiful nurses, who continue to make Trinidad and Tobago proud. Come out and get vaccinated. We love you all and we want you all to be out well. Come out and get vaccinated. Doctors who have not been vaccinated as yet, come out. And all frontline allied healthcare workers, patient escorts, come out and get vaccinated. Receptionists who interact with the public, come out and get vaccinated. If we do this by vaccinating 50,000 persons, because it's a 2-shot vaccine, so 100,000 doses translates to 50,000 people, this can have, ladies and gentlemen, a huge impact on where we go with our current numbers. Second slide, please. So we are starting off with these health centers under ERHA: Mayaro, Rio Claro, Sangre Grande, Toco. Under NCRHA, Darwin Thomas went through that. I would not go through it again. Under Northwest, we start off at Barataria, Carenage, Diego Martin, Mova. Under Southwest, Couva, Freeport, Laramie, Marabella, Point Fortin, Princestown, Siparia, St. Madeleine, South Oropouche, and in Tobago, Canaan, Roxborough, Scarborough. The phone numbers and contact details will be available on our website. Next slide, please. So you can start to make your appointments from today. Make your WhatsApp appointments, they are better. But if you make one WhatsApp appointment, don't try to make more than one, because it does place us in a disadvantageous position to reply to more than one. If you make a WhatsApp appointment, don't try to make one by phone. So make your WhatsApp appointments from now. I have been talking with the CEOs and we have agreed, because of we don't want mass gatherings, these are going to be strictly appointments only. Absolutely no walk-ins will be accommodated, so please don't congregate outside these health centers if you don't have an appointment. There is one major difference in the packaging between the Sinopharm vaccines and the AstraZeneca vaccines. Whereas the AstraZeneca vaccines will come in a vial of 10 doses. So once you open one, at the end of the day, if there's nobody else, then you could accommodate walk-ins, which used to happen. However, the Sinopharm vaccines are packaged differently, in that they are packaged in a vial of 2 or 3, I believe, 2 or 3 doses. So there's no more flexibility at the end of the day to vaccinate walk-ins. So I am appealing to members of the public. This is not a walk-in exercise to procure vaccine. You must have a firm appointment made on the different platforms that we have outlined. So come out and get vaccinated from Friday. You will be told which health center to go to. We will be vaccinating Friday, Saturday, Sunday, and into next week. It is our hope that we could finish this first phase in under 2 weeks. And once you get your first shot of Sinopharm, you will get an appointment almost immediately for your second shot, which has to be administered within 3 to 4 weeks. And you'll be asked to go back to the same site that you got your first shot to get your second shot. So the advantage with Sinopharm over AstraZeneca, you can be fully vaccinated in under a month, because the 2 shots have to be given within a 4-week window, as opposed to AstraZeneca, where it's an 8 to 12-week window. So it's a 2 to 3 month window to get fully vaccinated with AstraZeneca, but with Sinopharm, it's a 1 month window. So please make yourselves available for vaccination. Start to make your appointments today. So I have dealt with that. It is my task now to handle a very unpleasant situation which unfolded, unfortunately, on a political platform last night. And if left unattended, it has the capability of derailing and bringing healthcare workers into total disrespect. You may recall last Monday, I asked all commentators, political or otherwise, to refrain from bringing public servants, at that time, Dr. Roshan Parasram, Dr. Hines, and Dr. Richards, into your commentary, especially when they were accused of being less than honest. It seems to have held for a week. However, on a political platform last night, it was very unfortunate to see a former Prime Minister, a now opposition leader, questioning the integrity of our medical personnel. Before I get into the specifics, I want to say, like the Honorable Leader of the Opposition, when she says we are all in this together, that they want consultation, that they want unity, but her continuing narrative is anything but that. I will just give you 2 examples briefly before I get into the substantive issue. The member leading her team has flip-flopped on the issue of vaccines. 1 week, her chief vaccine expert says, don't be vaccinated. We're getting too many types of vaccines. A week later, a split emerges where those who should have been advising her from the very beginning, the medical professionals, had to come out and speak in support of the government's initiative. That's one. It didn't help. The second example as to why trust is important, the issue of taking claim for the erection of the field hospitals, whilst it may seem to be a non-issue, speaks to character. Where you take, as a former Prime Minister, where you take ownership of a project that clearly was not yours. It's not about taking ownership of a project and the political to-in and fro-in. If we cannot trust our leaders to be truthful to us on small matters, which can be so easily disproved, how can we trust leaders to be truthful to us in larger matters? And that's the problem. That's the problem. Taking ownership for those field hospitals speaks to the propensity not to be truthful. And again, last Monday, I put out a call that we should, if we do something wrong, tell us. If Dr. Hines or Dr. Roshan Parasram does something wrong, tell them. But the continuing probing and questioning of health professionals' integrity is to be lamented. Now, last night, a desperate person is now questioning the medical competence of doctors and nurses and indicating that government is guiding the hands of healthcare workers in making decisions. In defending the integrity of our doctors and nurses, these people have been our salvation for the past 14 months. They have won the admiration of our people, our region, and the world. And they have been doing back-breaking work. They are mentally tired, physically tired. And now, to be dragged into the political foray, where I am quoting the Newsday today, medical personnel are playing God with lives, determining who lives and who dies. Is it that some people are seeing themselves as God? This comment is bringing our public officers into odium. The government has not, will never ought to direct the clinical decisions made by a doctor or nurse. Every time we think that we can't sink lower, we seem to find the strength to do that. Let me reiterate how a P&M administration works. I don't know how a UNC administration works. The ministry makes overarching policy decisions, policy directions. The RHAs and their consultants and their nurses and doctors make clinical care decisions. They make those decisions. The government hand does not guide a surgeon. The government hand does not tell a nurse what to do. They are free from the hand of the government. But the modus operandi is to attack the independence and clinical competence of our healthcare workers. It makes the call for consultancy, consultation, and unity a flimsy one. We are all in this together. I know it sounds cliched, but we all have a responsibility to provide leadership at this time. And you know, the get out of jail free card that the member uses, she asks, is this true? Well, why don't you find out first if it's true? That is the get out of jail free card that the leader of the opposition uses. Is this true? In other words, she is not sure it is true. But you take a Facebook page and condolences to the family who lost that dear loved one. We all mourn that loss. I am not going to touch that issue. But you take a Facebook post and you go on a political platform and you disparage professional doctors and nurses. I stand here this morning as Minister of Health to tell the country that the government, the People's National Movement government of Trinidad and Tobago, does not interfere with the decision-making of any doctor or nurse. They act totally independently within the ethical guidelines of their professions and the clinical guidelines as set out by the RHAs. So, ladies and gentlemen, I call again for unity. I call for us to stop making these inflammatory statements which are designed to derail the government's effort, because some people are seeing this as a political salvation and to use as a horse to ride back into political office. This is not the time for that. This is not. It is only in Trinidad and Tobago where you have this type of pulling and tugging. Every other CARICOM country, government and opposition have put aside their differences and are supporting each other in rational measures, in rational decision making. And yes, if there is something wrong, point it out. But do not disparage people and then ask, is this true? Al, I want to thank you for the past few minutes, and we have arranged to go over time because we will start question and answer now, and we will go over time to give members of the media as much time as possible to make their contributions.
With that said, thank you very much, Minister. I'm asking our media representatives to begin by stating your name and the name of the media house that you represent before you put forward your questions to our panelists. In order for us to get the most out of this segment, our time constraints must be acknowledged, and as such, we request that a maximum of 2 questions per media house in the first instance. Of course, as you know, if time allows, we will facilitate 1 additional question for your media personnel. We begin this morning's question and answer with GML, Guardian Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question, Minister Dayal Singh. There were some calls yesterday for pharmacies to actually join that vaccine distribution process because they're saying that they have all the equipment necessary and that could probably help ease some of the burden from healthcare workers. Is that something that you see realistically happening? If not now, probably later down the road within the vaccination drive? And my second question is this. Now, Mr. Thomas would have raised the issue of increased testing capacity. So Minister Dayal Singh and probably any of the other experts there on the panel, I just want an update on those rapid antigen test kits that we received in October. Now, we've asked a couple times over the past few months and they're saying that it's being validated. It's in the process of being validated. But now with it taking so long, it's now about 8 months since we've received them and it's still being validated. A couple questions arise. Is it that these test kits may not necessarily be a viable option? Because if it's taking that long to validate, then is it just not up to the standard that we were looking for? And even if this comes into play,
so Rashad,
dynamic.
Oh Lord. All right, thank you very much. So Rashad, I'm going to answer both questions, and I continue to say, let us talk from a position of fact. The fact of the matter is the chief medical officer is on record at these press conferences saying in the past weeks those kits have been used. So Rashad, the kits are being used, have been used, are validated, are up to standard. I just implore everyone when they are making their commentary to be, I'll leave it at that. The issue of pharmacies and vaccinations, we have been exploring this possibility of using allied health professionals for a couple of months. We have reached the stage where the legal opinion is that pharmacists cannot be used. I also have the Attorney General double-checking that. But the legal opinion at the ministry is that pharmacists cannot be used. Pharmacies have been used in the past in Trinidad and Tobago for the H1N1 vaccines, but administered by a doctor and or nurse in the pharmacy. So there's a distinction. We are clear that the legal framework at this point in time allows for some allied healthcare professionals, example, EMTs, vets, dentists, to do this. And we have reached out to the University of the West Indies already to just mount a small training course so that we want to train up 100 to 125 persons to help us with our mass vaccination sites. So we have already contemplated that. We have gotten the legal opinion as to who can be trained as vaccinators. My advice is that pharmacists, because of maybe the Pharmacy Board Act or whatever, cannot be trained as vaccinators, but other allied healthcare professionals can be. We're already in talks with UE, and we are looking for 100 to 125 persons to help us in the mass vaccination site. So thank you for your questions, Rashad.
And thank you, Minister. We now go to Newsday. Newsday, we are ready for your question.
Good morning, Narissa Fraser from the Newsday. My first question relates to something the Education Minister would have said. She said she submitted the names of all school personnel to the Health Ministry for priority consideration for the vaccine. So I wanted to find out if a decision was reached yet. Secondly, there's a pharmacy in South Trinidad that has been advertising themselves as selling rapid antigen testing kits. for $210. I wanted to know if the ministry is aware of this and how does that work going forward with tracking cases?
Thank you. Thank you for your two questions. So the example of teachers, yes, teachers are going to be considered. So we'll be reaching out to them once again. Two, the issue of the pharmacy and the rapid antigen test. I had a specific discussion with the chief medical officer this morning that we are going to be investigating all of these and bring the necessary charges to bear. The charge under the public health regulations, I believe, is a couple $100,000 and 6 months in jail. We are taking this very, very seriously. So thank you for raising those two important issues.
Excellent questions. Thanks for the response, Minister. We quickly go to IETV.
Hi, good morning, everyone. We're doing here some IETV news. I have two short questions, perhaps for the Minister. My first questions would be the issue of nurses are reporting that they're overworked, understaffed, and really very much stressed. Are there any plans by the Ministry of Health to add further support to the nursing system? For example, bringing in nurses from Cuba, for example. And my second issue, there have been reports that persons are waiting in the tents outside the various medical centers for 4 to 5 days. Some of them are dying while waiting for bed space. Can you confirm this? And how many persons, can you tell us, would have died from COVID-19 outside of the ICU system? Thank you.
Thank you. So Mr. Davlin Thomas spoke earlier about the support that we are giving to nurses. He could probably reiterate that. We are activating today the field hospital at Jean Pierre Complex, which will alleviate the problem, yes, of persons waiting to get into a hospital system. So that field hospital, I spoke to the CEO of NCR Northwest RHA this morning. That is going to be activated later today. So that is going to give us a significant ease. Also, the field hospital at Covert, Davlin can probably go into that, should be up and running by around Friday. That will give us a significant ease. So over to Davlin to say what sort of support, again, that he is given to nurses and healthcare workers in general.
In particular for nursing, well, of course, we have the system where we have introduced psychologists and psychiatrists as well as other social services support. But some of their basic needs, we engage at the NCRHA. We transport, as you know, nurses to and from the hospital system, so they don't have to worry about that. We take care of their meals at the facility, so that is also ongoing. And with regard to the field hospital, we should have that field hospital ready by Friday. The approaching Friday.
Thank you very much, Mr. Thomas. We now go to the Express.
Good morning, Camille Hunt, Express. Minister, there was a report yesterday coming out of Bermuda that they have excess vaccines, some of which are close to expiry. So they're considering giving them to Trinidad and Tobago rather than having them expire and waste. Have we had any communication with the Bermuda government on this? And forgive me if it was said and I missed it, but what is the expiry date on the Sinopharm vaccines?
Okay, thank you. So any communication with the Bermudan government or any other government, as you know, will take place through the Ministry of Foreign and CARICOM Affairs. What I do know is that the Ministry of Foreign and CARICOM Affairs did have talks with the Charge d'Affaires of the U.S. Embassy, Mr. Shanti Moore, to make sure that Trinidad and Tobago does in fact get some vaccines out of that initiative. I will follow for the Bermuda initiative. Your second question as to the expiry date of the Sinopharm vaccines, if you hold on 1 minute, I have those details here. Now, you must recognize that the Sinopharm vaccine, as the Chief Medical Officer explained on Monday, I believe, it's a different type of vaccine as to AstraZeneca. The Sinopharm vaccine uses a very old technology. It's a very old tried, true, and tested technology. Because of that, and because of the experience in that type of technology, I think it's an attenuated virus.
Yes,
yeah. The expiry date is much longer, and it's April 2023. Okay? So, but it will be used up hopefully within a month to 6-7 weeks. Thank you.
Thank you for your question. We now go to I-95.5.
Good morning, everyone. Whitfield Turner from I-95.5. So I just want to take off on the response to ITV's question. Have we also taken action to boost the number of contact tracers and other personnel who would be required to work with persons in home isolation as well? And also, if you can let us know of the total number of COVID positive persons thus far, what number of that would have come from the homeless and migrant communities?
Thank you very much. Dr. Hines, could you address the first question? Thank you.
Okay, thank you for the question, and the short answer to it is yes. In each of the CMOH offices, there has been augmentation of the complement of staff that is engaged in the contact tracing activity as the need arises and as the surge demands. So yes, there is that expansion of support for that very vital activity. Now, with regard to the second question, to the best of our knowledge, there hasn't been anyone who has been indicated as being from the homeless population. The likelihood, really, of somebody from the homeless population getting into contact with somebody with COVID-19 is, to some extent, decreased by the fact that we tend to physically distance quite effectively from the homeless population. I'm not sure if you've noticed, but we tend to maintain the 6 feet and the sanitization afterwards. And so the tendency for that population to be acutely affected is actually limited by the limited interactions. With respect to the migrant population, the numbers for that are not immediately available to me, but we can always double check and see what proportion they comprise, but it's actually a relatively small proportion. So if you're wondering about size, it's a reasonably small proportion, but we can confirm numbers and bring that info back at a subsequent point.
Thank you very much, Dr. Hines, and thank you for your questions, I-95.5. We now go to AZP. AZP News, we are ready for your questions.
Hi, good morning. Priya Bihari, azpnews.com. My first question, I don't know, maybe Dr. Hines can answer. I want to find out how many people have passed away and who have received the first jab of the AstraZeneca vaccine. And there seems to be a number of younger people dying and people without any sort of pre-existing conditions. Can you explain why that is the case in terms, from medical perspective, what do you think is the reason for that? And my second question, the Sinopharm vaccine, there have been reports that sometimes someone needs a third jab because their immune response is low. Can someone tell me how would we know that our immune response is low and when you would require a third jab of the Sinopharm? Thank you.
All right. Thank you very much. Dr. Hines, could you address the questions?
Okay, so the first question being about let's go backwards a minute. The third jab or the need for a third jab and how you'd know your immune response is low. This is actually data that is compiled at an international level, where they look at the responses some time out from your initial vaccination. And to the best of our knowledge, at this point, the immune response and the protection is not that short-lived. But of course, because the vaccine is relatively new, the time frame over which that immune response will last is still under assessment. If it becomes apparent from the international data that additional booster shots are needed, then the policy around the administration will be amended first in the international guidelines and then at the national level. So that is something that actually comes out of ongoing follow-up and ongoing research. The first question, there was at least one report of an individual who had passed on in spite of having had their first jab. And that was, if memory serves, that was somebody who had the first jab not that long before they actually then tested positive, which is something that people need to remember. You can be vaccinated, and in the first 2 to 3 weeks thereafter, while your immune system is still building its response, you still are at a moderately high risk of contracting the virus if you are exposed. Even after full vaccination, the risk isn't reduced 100% of being infected, but the risk is reduced into the high 70s to 80s of having severe illness. So people can still get the infection even after a first or a second jab. But with the vaccine on board, what you have is a great reduction in the severe illness, the need for hospitalization, and the risk of death. So the main points: it's possible to still get infected after being vaccinated. It is possible in the early part of your immune response to still have an adverse outcome because your immune response hasn't had enough time to build itself to the point where it protects you from adverse responses. So that's a possibility that we'll continue to face. But as we get the vaccine rollout going and more people have their 2 shots, then we will have that commensurate reduction in severe illness and in fatal outcomes. So hopefully that answers your queries.
I just want to come in here prior. Ladies and gentlemen, the way the question was phrased on Sinopharm third jab needed to be expanded to have a proper discussion into third jabs in general. Because if we leave it hanging that Sinopharm needs a third jab, it decreases vaccine confidence in Sinopharm. Let me read about Pfizer. Pfizer CEO Albert Bourla said people will likely need a third dose of the COVID-19 vaccine within 12 months of getting fully vaccinated. He went on to say, it is also possible people will need to get vaccinated against the coronavirus annually. Ladies and gentlemen of the media, I am trying to guide the discussion on vaccinations in a manner that all the issues surrounding vaccinations are raised from a point of view of knowledge. It is not only the Sinopharm vaccine that is being recommended for a third dose. It is also the Pfizer vaccine made in the United States. And as Dr. Hines says, with more and more experience with the vaccines, remember, we are using these vaccines now around the world for only about 6 months. More and more evidence will come out, but I just want to shade all the discussions about a third dose. It is not only for the Sinopharm vaccine. It has been mentioned that even Pfizer needed a third dose months ago. So I hope I have lent a certain degree of clarity to the issue of a third dose vaccine for both Sinopharm and Pfizer. Thank you very much, Al.
And just to clarify part of the question that AZP would have asked about why younger persons, if so, passing away from the virus.
Okay, thanks for that. Let me just... So what we're seeing at the present time is large numbers of people being ill, and among those numbers there's a proportion of those that are in the under 50 age group, which we're seeing being a little higher, sorry, the under 60 age group, that we're seeing being a little higher than it was previously or earlier on in the outbreak. Now, the reasons for this from a clinical perspective vary. Some people had comorbidities, some did not. Some people would have had comorbidities of which they were not aware. And then there's always the sort of very hyperactive immune response that can happen with new viruses that can put some people into a very ticklish clinical situation very quickly. And there's no real way of knowing when that would happen or to whom it would happen. It isn't linked to any known or existing risk factors, but we do see that happening with pandemic viruses. With pandemic influenza in 1918, there was the tendency for younger people to have this sort of very violent immune response to the virus that then did some damage to their tissues, including their lungs, and made it difficult for them to breathe. There is some research that suggests that there's a small component of that also happening without any particular risk factors that identify who would be at highest risk. So the most important thing for all of us, young and old, to do and to remember is that what we can do as a population is reduce the risk of becoming infected by reducing our movement, by reducing our interactions at this point in time when everyone is supposed to be at home unless they're doing something essential, by continuing to wear our masks, especially when we are in indoor settings, in offices where we have to be, and continue to wear masks in general once we are outside of our homes, by wearing our masks in our homes if we are infected and home isolating, by wearing our masks in our homes if we are exposed and quarantining. These are the ways that we protect ourselves and others around us from being infected and from having the possibility of having these severe reactions. So I just want to make sure that we emphasize that above all things as we move forward.
Al, thank you. I just want to come back briefly to the issue of vaccines. Ladies and gentlemen, when the United States started their vaccine program, they had 3 vaccines going. And the advice all the medical experts were given the United States population, and it is redounding to their benefit because their cases have plummeted. Whichever vaccine is available to you, take it. The best vaccine for you is the WHO vaccine that is available to you at this point in time. We are only bringing in WHO vaccine, so you have that stamp of approval, that stamp of confidence. Whichever vaccine is available for you at that time is the best vaccine for you, unless you are specifically precluded, like being pregnant or anything like that. So I just wanted to encourage the population to take any vaccine, any WHO approved vaccine that is available to you at this point in time. Thank you.
Thank you very much, Minister. We now go to Astronaut News. Astronaut News, we are ready for your question.
Gwyneth Stewart, Astronaut Health News. Good morning, everyone. My first question is to Minister Diyal Singh. The Ministry of Health currently has a comprehensive national strategic plan for combating non-communicable diseases. In light of the critical role NCDs play in the contraction and the severity of COVID-19, what are the MOH's intentions for implementing this strategic plan during this crisis period? And my second question is to Dr. Hines. Dr. Hines, we are thankful for all the MOH updates and statistics, and members of the public are requesting additional details on COVID-related deaths. For example, at the time of death, how many were in ICU or HDU, how many at home, how many at hospital on ventilators versus awaiting treatment, etc. Would it be possible for these stats to be provided, and how soon?
Okay, thank you. So I'll take the first question and then Dr. Hines can go in. So Gwyneth, where have you been for the I haven't seen you around in a while. Well, welcome back and thank you for the question. So our NCD program, like everything else, would have been impacted by COVID because you can't do as much outreaches as you would like to. However, it doesn't mean we are not focusing on it. We continue to focus on rolling out programs. You would have seen earlier in the year, we launched several gyms for young persons to exercise in Mayaro, in Diego Martin, in a couple other places. We have implemented, and it has been successful, even though schools are out, the banning of sales of soft drinks in schools to protect our children. Our diabetes wellness centers, like in North Central RHA, all those are up and running, functioning and providing valuable service to help people change their lifestyles. That goes on uninterrupted. In the coming months, I am hoping, I took a note to Cabinet to create for the first time in this country a position similar to the Directorate of Women's Health, to have a Directorate of the NCD program, to launch and manage the total non-communicable diseases program. First time in the history of Trinidad and Tobago you will have that. Another initiative we are working with NCDs, and this is one I'm particularly excited about, is a gestational diabetes project with the Inter-American Development Bank. We are close to implementing. This will tackle the issue of diabetes in pregnancy. Too many of our pregnant women turn up at our hospitals diabetic and not even knowing it, and have negative outcomes in their pregnancies. And as the doctors will tell you, a diabetic mother tends to give birth to a larger baby, which then has the tendency to be a type 1 diabetic. So we are tackling the issue of NCDs from mother to child. So thank you for the question, and look forward to exciting things in the future on the NCD front.
Thank you very much, Minister. We move across to Tobago as we welcome Radio Tambourine.
Good morning, Clayton Clark, Radio Tambourine. My first question, the Sinopharm vaccines, how many are scheduled to come to Tobago? And my second question, the reporter from ITV sort of alluded to what I was asking in regards to the status of nurses. The Nurses Association's president was this morning actually outlining some of the challenges, particularly with nurses interfacing with patients, being the only person of contact and relatives, not allowed in. But he was highlighting the fact that in terms of having to deal with death, it's very kind of blunt for the nurses having to call relatives. Not the usual way of breaking the news, but he's concerned about the not just the physical wear and tear, but the mental, dealing with the whole issue of death, patients dying and coping with it. And he was talking also about patients suffering from insomnia, so want to find out what, particularly in the month of May with all the high numbers of death and positive cases, what is the ministry, what is the ministry doing to deal with this particular challenge that nurses face at this particular time? Thank you.
Thank you. So I'll take the first question and part of the second one. So in talks with the Secretary of Health, Wellness and Family Services, my counterpart, Tracy Davidson Celestine, she requested 3,000 doses of Sinopharm vaccines for Tobago, and that will be given to them. So 3,000 doses for Tobago, what she asked for, we readily agreed. That means she could vaccinate a further 1,500 persons. On the issue of nurses, yes, and both myself and CEO Thomas, and he will go into detail again as to what type of psychosocial and psychological support we are providing for our nurses. And you are spot on. We have always said from day one, our nurses are the backbone of this thing. And we recognize the difficulty they are having. So, CEO Thomas, over to you.
Thanks, Minister. We certainly appreciate the questions that are coming up, with regards to nurses. In addition to the psychosocial support, there's a real need to provide that barrier from the infection, which comes from the PPEs or the personal protective equipment. We do have the standard and higher equipment that is required. The nurses are fully protected in that regard. Within the hospital situation, in the donning and doffing, that is the placing on of that equipment and the taking off of that equipment during the nurses' engagement is supervised by a force of IPC personnel who are also nurses and as well. So that barrier between the nurse and the disease is formidable. In addition to the processes and procedures that are in place to ensure that takes place. The other question of debt and the handling of debt, the protocol to engage families with regard to debt involves clinicians rather than nurses. So in those situations, the clinicians are engaging the families. Thanks, Minister.
Yes, thank you very much, CEO. We would have missed a question from Astronaut News regarding the categorization of COVID-related deaths. Dr. Hines, if you could address that question, please.
Okay, thank you for that additional question. I'd just like to re-emphasize that we had at some point in the past, when we had far fewer fatalities, given out some tabulations on some additional information with regard to risk factors, age groups, etc. We will again update this and make it available. I do want, however, to track one specific sub-question, which was those who were dying at home, which I believe was also asked by another reporter in a previous press conference. And what we have on record is that there would have been, throughout the entire pandemic for us, 16 people recorded as having died at home. What we are seeing right now is that is about maybe 5% of the total, and within the month of May we would have heard of a few, because 7 of those actually occurred within the month of May, but in the month of May we had 148 fatalities. So again, that's around 4 to 5%. So it's not that there's an increasing number or an increasing proportion of people who may have passed on at home, but just that the numbers overall give you that sort of impression because of how much is happening at this point in time. So I hope that answers the current and the previous questions with regard to deaths at home. Also, just to re-emphasize that sometimes the situation is that individuals who are having deterioration actually sometimes do not wish to leave home. There are also those who deteriorate quite quickly and they didn't get to actually call for help before they passed on. So things differ. And because of this, what we do want to encourage anyone having any serious or increasing discomfort, distress with breathing, etc. Once you start to feel anything change, please make sure to call out to the ambulance, reach out to the health system for help in the shortest possible time frame. Don't assume that, okay, it will settle. Let us, as the health system, provide you that support so that we can avoid, where possible, those sorts of outcomes. So thank you for the opportunity to address that.
And thank you very much, Dr. Hines. We now go to TV6.
Good afternoon, Renessa Cutting, TV6 News. I wanted to find out what is the policy for discharging patients from quarantine, because we're getting reports that the ministry is no longer doing follow-up PCR tests to confirm positivity or negativity. And on that note, I wanted to find out if we could get like an inventory, like a number of swab or test kits, swab kits that we have, because persons are claiming that this is due to a shortage, suggesting that we're somehow running out of this testing kits. Thank you.
So I will take the second question, Renessa. There is absolutely no truth that we are running out of swab kits. There is no truth that we are running out of PPE. I just want to reinforce that. So I just want to put that to rest, and I will let Dr. Richards take the other part of the question, but thank you for raising the issue.
Thank you very much, Renessa, for an excellent question, especially given the number of cases of COVID that we have been confirming. Now, the policy for the discharge of persons who are COVID positive and are under self-isolation, because if you're COVID positive, you're isolated as opposed to being quarantined, was amended several months ago as per the Ministry of Health policy, based on evidence from the World Health Organization. At present, the COVID positive confirmed patients who are under self-isolation at home are monitored by the CMOH's office and basically would be self-isolated for any time between 17 and 21 days, depending on their clinical symptoms. Of course, we do have a policy for admission into the facilities once a person may have deterioration in terms of their symptoms. There is one exception, though, in terms of the reswab that occurs at the end of that period, and we do an exit PCR test on returning nationals who are COVID positive. These returning nationals, as per the Ministry of Health policy, who are COVID positive, are considered at higher risk of being COVID positive with a new variant, and so those persons are tested to ensure that they are COVID negative, and we do variant testing on them. A similar policy applies across the energy sector, which of course is managed by those physicians in collaboration with the Ministry of Health. And again, that is to ensure the safety of persons and crew members on the platform if they have to return. So thank you very much for your question.
Thank you, Doc. Our final question comes from CL Communications.
Good day. Are you hearing me? Yes?
Yes, we are.
Good day, Natalie Singh, Caribbean Lifestyle Communications. These two questions, in fact, came from the public. Thank you very much for extending the timing for questions, especially when some of my colleagues did not get the opportunity the last time to ask their question. The first one is people are complaining that they didn't have, they did the PCR test and they are still waiting on the results from those tests. And I was just wondering, well, what was the keyback? And then the second question is, what's the time difference between taking the first dose of the AstraZeneca vaccine and the second dose of that vaccine? That person who gave me this question said that they went to a health center and the health center told them that is 3 weeks time difference between taking the first dose and the second dose. I was just wondering if you can clarify that for me. Thank you.
So I will take the second question first. Yes, as we indicated earlier, the interval for the Sinopharm vaccines between first and second dose is 21 to 28 days, which is spot on 3 to 4 weeks. Okay? Thank you very much for allowing me the chance to reiterate that. Dr. Hines, you could take the first question, please.
Okay, just to clarify, Minister, I think the question that the person was asking was about the AstraZeneca vaccine.
AstraZeneca, sorry.
The Sinopharm is the 3 weeks. The AstraZeneca, which I believe the person had been administered before, they were saying that they had been told that was 3 weeks, whereas we've stated that the time interval is between 8 and 12 weeks for AZ. So just making sure that we have both of those, AstraZeneca 8 to 12 weeks, and the Sinopharm 3 weeks, 3 to 4 weeks, within the given time frames as recommended by WHO. Can you repeat the first question, though?
Yeah, the first question.
Right. So the first one was people are complaining that they haven't gotten results from the PCR tests, and they're still awaiting, even their employers are awaiting the test results from the PCR test to determine whether or not the person has the virus or not. I was just wondering, like, what was the keyback or what is the rationale for this? Thank you.
Okay, so that is more of an operational issue on the ground where results getting back to individuals requires somebody to actually call the individuals with the results, and whereas the results being generated at the lab may not have a keepback, there may be a bottleneck in terms of the number of people who can place calls to these now, as you have noted, thousands of positives. So while those results are awaited, what we do want to recommend both to the employers and to the individuals is that you act as though you were infected until such time as you are told otherwise, and to maintain all of the isolation and quarantine guidelines that would apply to you, so that you run less risk of infecting other people as you wait. But that there may just be a little bit of a bottleneck in individuals being able to reach out and provide the results based on the sheer volume.
I just want to go back to the question about the time interval. Sorry if I misinterpreted your question. So let me just reiterate what Dr. Hines said. So we are going to be having 2 vaccines very shortly being administered in Trinidad and Tobago. First dose Sinopharm, which starts on Friday, and the time interval for Sinopharm is 21 to 28 days between first and second dose. That is set. Then we will have to start to administer second dose AstraZeneca, and the time interval for second dose AstraZeneca is 8 to 12 weeks. So I do apologize if I misinterpreted the question, and thanks for Dr. Hines for clarification and for allowing me the time to re-clarify.
I believe, Dr. Richards, you had some additional information to share.
I'd just like to share some information regarding the time for testing with respect to the turnaround of lab results. Dr. Hines stressed that this is an operational concern and a challenge we faced over the last 2 weeks due to the rapid increase in the number of cases. However, we do have conditions, and we have been trying our best at all our labs. We appreciate your patience and your collaboration with us, and we would like to reiterate, especially the persons who are in home isolation and the primary contacts, please adhere to the Ministry of Health's guideline. And as Dr. Hines said, let's continue to watch our 3 Ws and to comply to them. Thank you very much.
Thank you, Dr. Richards. And I'll hand you over to the Honorable Minister of Health.
Thank you very much, Al. And thank you, ladies and gentlemen, for the media, for your very good questions, very strong questions. These press conferences always help to educate and inform the public, and I am so grateful for the dialogue that we have. It in no way, it helps a lot in having people, more and more people, adhere to the guidelines. I just want to commend the Trinidad Guardian as I close today, because we are in this together. It's a partnership. And the Guardian opinion today in the editorial, the headline is "Citizens Must Help with COVID War." The healthcare system can do so much and no more. We are stretched. We have made no secret of that from day one. There is a limit as to how many beds we can put on. There is a limit to our human capacity. There is a limit to the physical and mental well-being of our healthcare workers. I just want to quote the last paragraph of the Guardian editorial today. And it goes like this: "It should not have taken a state of emergency to achieve full compliance with the health protocols, given the startling loss of lives and cases now experienced daily." So they are saying a state of emergency should not have forced us to comply. Still, full cooperation with health officials, Dr. Richards, Dr. Hines, Mr. Thomas, the CMO, the doctors, the nurses, full cooperation with health officials remains the biggest factor in staving off COVID-19. It's not only hospital beds. The Guardian is clear, crystal clear, that we need full cooperation. And only citizens, that is Mr. and Mrs. Trinidadian and Tobagonian, the majority of whom have been responsible. But it is just that one person who decides to, even after SOE, to go down to Chagaramas. It just takes that. Or to go to Lupino on a hike. It just takes that one spark to turn a spark into a flame, and a flame into an inferno which we can't control. And only citizens, not an SOE, can help win the battle to save lives and everything else affected. Ladies and gentlemen, that last paragraph of the Guardian editorial is by far the best commentary I have seen in recent times. All of us, regardless of whether you have a SOE or not, should do our parts. If you are ill at home, isolate. Isolate means stay in a room by yourself as far as possible. If you have to come out, wear a mask, even though you're at home. Do not congregate for any reason whatsoever, both in your private setting and in your public setting. Congregation is what gives the virus an opportunity to jump from person to person and spread. So, SOE or not, and the Guardian editorial is spot on. It should not have taken an SOE for us to wake up to this reality. And if we do that, this war that we are fighting against a virus that knows no political boundaries, no ethnic boundaries, is no respecter of color, class, creed, or race, we can once again win this battle. But it must be a team effort where everybody sees themselves as a soldier in this fight. Ladies and gentlemen of the media, I continue to thank you for attending these press conferences and illuminating the different topics that you do. It only helps us get information out. Thank you very much. May God bless each and every one of us today. And may God bless Trinidad and Tobago. Thank you very much.
Thank you very much, Minister, for your encouragement. And thank you very much, Minister, for your encouragement and advice. As we close, we would like to thank our panelists for providing us with the updates, the media for engaging questions, and you, our listeners and viewers, thank you for sharing your time with us today. Goodbye for now.